Hello, good evening, everyone. Thank you for joining tonight's webinar. Our webinars are recorded via WebEx and will be made accessible online after the session. We're now using Cisco WebEx Event Center. Having trouble streaming, log out the session and join through the link sent to you by WebEx or by entering the meeting room number 574-808-171 and password is HIS123. May we remind attendees that your mics are muted throughout the meeting, but you can chat your thoughts to us through the chat tab. And for questions, please type them in the Q&A tab. Tonight's speaker is Ms. Alice Liu. She is the Director of Information and Communication Technology for Development at Chicago, where she is responsible for the strategy, development, and implementation of health system strengthening, ICT interventions for program initiatives in limited resource environments. Ms. Liu has 10 years of development sector experience in ICTs for global health, financial services, and agriculture. Before joining Depigo, Ms. Liu has applied her skills for organizations such as WHO, Rockefeller Foundation, Voxiva, FHI 360, Mercy Corp, and Timonix. Prior to working in international development, Ms. Liu worked in the technology sector in California, managing teams to deliver multi-million-dollar e-commerce, data warehouse, and customer relationship management systems through the full project lifecycle. Ms. Liu earned her MBA from Yale School of the Management and a Bachelor of Science degree in Computer Science from the University of California, Santa Barbara. We will now call on our speaker, Ms. Alice.
Hello, how are you? Okay, let me switch over to sharing my desktop. Can you all hear me okay?
Yes, we can hear you well, Ms. Alice. Thank you.
Okay, so let's put this slideshow into slideshow. What's happening? Slideshow. Here we go. Okay. Okay, so I hope you all are seeing the title slide here. To build, buy, or outsource, that is the HIS question. Thank you. Good evening, good morning, good afternoon, whatever time it is for everyone. Thank you for making this time to attend the second webinar in this series on HIS. And thank you to AHIN for inviting me back to continue. I just want to acknowledge that this is actually based on some work done several years ago for the Rockefeller Foundation, Voxiva, and the WHO Health Metrics Network. So we're leveraging these materials, you know, these best practices and approaches really have not changed that much. We ask ourselves these questions all the time. So let's go ahead and dive in. So what we're going to do is I'll briefly explain at a high level what the build, buy, and outsource choices are. You know, you can probably drill in and find even you know, finer grain ways of defining them, but we'll try and stay high level. And some of the key decision factors that I've learned over the years, you know, these are not necessarily the definitive list, but it's again from my experience, these are often the factors that come into play. And then we'll summarize. Okay, so the three main choices are to build or buy, and you know, this is what we used to say. I would say up until you know, let's say up until the 2000s, the year of 2000. Because that was pretty much your only option, to build software or to buy a software package from a software company. But you know, in the last 10 or you know, maybe I guess 15 years or so, outsourcing has become a very viable option and has evolved. So what I've done here on this slide is just provided some of the terminology that's used, because you may hear these different phrases from time to time. So this will hopefully help you recognize. Sometimes you'll hear about building software from scratch. And I'm thinking that might come from the idea of cooking or baking from scratch. You know, you're taking these raw ingredients, you have the chef and the cook in the kitchen, putting something together to produce that wonderful meal or wonderful cake at the end. So software hopefully is something similar. You are pulling together a team, taking these raw ingredients and raw skills, and producing the software at the end. Buying software, we're probably pretty familiar with what that concept is. You may hear this phrase, although I don't think it's used as much anymore, commercial off-the-shelf package. You might see this in older procurement documents, but so I list it here just in case. But that means, again, buying an existing product from a company that's in business to sell software. That's the commercial venture that they're in. And it's off the shelf, ready to go. Probably needs to be adapted to your needs, but it's pretty much works as soon as you install it. And then outsourcing, and this has evolved to other terms, software as a service. I think it was Salesforce.com that popularized that phrase. And you're essentially renting the software. They are providing all the functionality over the web usually. They've got it all on their servers, all stored in their databases, hosted off-site, not hosted at your company on your servers or at your organization and on your servers. Now we talk about everything being in the cloud. So like I said, there's probably ways to define and distinguish these terms a little bit more. What's the cloud versus software as a service? But we don't want to get too bogged down in that right now. Just I think keep in mind these main distinctions between completely building software by yourself, partnering with a software company to buy their software, or partnering with a third party who has all of that hosted and maintained by their staff on their servers, and you access it via the web. Okay, so these are the decision factors that I've learned over the years, as I mentioned. Again, not necessarily everything you have to think about, and some factors may be more important to you and some may be less important to you. So these are usually the pressures we're under when we're implementing any system, really. The time to implement. Usually there's a deadline. And actually, what I like to say is usually we're behind before we even got started. Because by the time someone approves a budget for you to implement, the need has become very, very, very high. The cost is always going to be a consideration. Your requirements for the system, kind of the types of functionality, the complexity, the environment that you operate in, the users, all of that can drive what your approach will be. Again, how custom your environment is, or how specific or unique it is. That's a factor. What's the local market look like? Who develops software for your particular need, for whether it's an HR information system, it's electronic health records, it's inventory management. Who are the main companies providing that kind of software, and who provides it in your environment, in your country, in your context. Same with the outsource solution providers, who also is available, who can provide the kind of software you're looking for, the kind of system you're looking for. You may have a lot of options, or you may not, so that will definitely factor into your decision. Again, the skill and availability in your context, in your environment, what skill and availability of IT staff is available, and the local IT sector. That will factor in. You may have certain technology preferences or standards that the system must comply with. So that will be an issue for you to consider. You'll have other requirements around the availability and the performance and security of the system, and regulations and government policy will also could influence your decision, and there can be other priorities. So we're going to talk about each one of these, dive a little bit into each one of these, and I'm hoping there will be time for questions at the end. And I'll try and watch the time, make sure there's at least 15-20 minutes at the end. Okay, so what I wanted to show here is, what does the implementation lifecycle look like? For people who implement HIS systems as their career, this process is very familiar. But for those of you on this webinar who aren't familiar with this, this is a very high-level conceptualized diagram of the life cycle. For the sake of being able to fit everything on one page, I've compacted some of the steps from project initiation and requirement specification and procurement decision on the left. The other intent here is to illustrate that some of these processes happen in parallel or are continuous. Program management and change management are continuous. Some can overlap. Business process analysis and solution design will overlap. And you may hear about different methodologies, which we aren't going to go into here. But sometimes you may follow this process a bit more sequentially, and sometimes you might iterate and do a little bit of design, a little bit of development, get user feedback, and then go back to design and go back to development and get user feedback. And you may iterate several times. Again, not to get into different methodologies, but this is to show you that there is a continuum to get from the initial kickoff of the project and specifying requirements and making your decision on which approach you're going to take to the procurement, to actually implementing, going live, and then operating the system, maintaining the system, enhancing it, supporting it. The colors are also, again, for the benefit of people on the line who aren't as familiar with these kinds of implementations. There's a lot of business process analysis involved, and business here, we're using in that term in quotes. Most of you, I think, on this call are probably operating in a government health institution, but it's about what are your workflows, what processes you have. These kinds of system projects often lead you to re-examine those processes and workflows and find ways to optimize them. You discover where you have inefficiencies, and you discover opportunities to optimize them, and the system can help you with that. There's a lot of different people involved in these projects, and I found in working in the international development sector that's very new. People can always imagine that they need developers. They're always thinking, I need to bring a developer onto my project, but they don't realize there are different skill sets involved in these implementations, and they're involved at different times. So these color coding, this color coding is a bit subjective. Obviously, I'm thinking when I look back at this, I'm thinking maybe for business process analysis, I should have coded that as green, meaning it involves people just as heavily as it is an intensive process. So I hope this is a helpful illustration of the life cycle. And again, like I said, most of the time these projects are behind before they even get started. Someone wanted this system, and it's finally, the pain is finally painful enough that they're willing to allocate the money and the resources. So now we can begin. All right, so this is another diagram or bar chart to also illustrate the differences between the choices. It's a pretty generally accepted knowledge that building software from scratch will take the longest amount of time. because you are starting quote unquote from nothing, and you have to do everything from the very beginning, from zero. It's also the riskiest approach. When you're buying software or you're going with a software as a service provider, they've got hundreds or thousands of customers who have really tested that system, right? They've been using that system for years. The bugs have been worked out, enhancements have been made based on the customer feedback. So there's a pretty good chance that there's a system out there on the market already that can do most of what you want. If you haven't heard the phrase 80-20 rule, that's generally what we think about. That there is no system out there that is going to fit your needs perfectly, 100%. But if it can fit 80% of your needs, that's good enough. And the other 20%, you don't need to be as concerned with, because in my experience, I found that after you launch the system, the user's priorities change. Now that they have the system, they're using it, that other 20% may not be as important to them. And they may have different requirements that become more important once they've started using the system and gained some experience and understanding. So, this is obviously very hypothetical. Not every project is something that will require 400 days or 300 days. It may be more or less time. So this is just an illustration. All right, the second factor we talked about in that previous summary slide was the total cost of ownership. And I broke this down into 3 areas. First, the tangible costs. Most people understand this, right? Most people understand you have to procure software license or you have to purchase hardware. You may, depending on your environment, you may need to improve the infrastructure. You've got to install more networking. You've got to wire the buildings, so on and so forth. You need staff. You may need to engage contractors or consultants. So people are pretty familiar with this. And of course, the entire implementation, that's maybe it's partly intangible, but it's also tangible in that you're dedicating 6, 9, 12, 18 months to this project. That that is going to incur costs. The second portion of the total cost of ownership is ongoing costs, and some projects and some funders don't really take this into account. So I think this is important to talk about. These systems don't magically support themselves. They need to be maintained. The systems need to be backed up. The software may need upgrades. There are patches to be applied. There are bug fixes that the software company may issue that you need to apply. You have to pay for support so that you can contact them when you have a potential issue. And of course, you've got to pay for your staff to provide ongoing application or data management, reports development. And the amount of staff will vary depending on if you decided to build the software completely from scratch or to buy or outsource a system. But you still need staff, even if you buy or outsource a system, because they are going to be the ones developing reports for the users, developing the analytics, dashboards for the users. Maybe they're adapting the dashboards that came and they were provided from the software vendor, and they're adapting them to your needs. And the training, you will always need to do training. There's always going to be turnover. Staff leave, new staff are hired, and you have enhancements that are applied, so that will require training. And then hardware. Hardware, you have to plan for upgrades and replacement because that hardware depreciates. And I think generally accepted accounting principles still say that by year 3, I think the PCs are fully depreciated. I don't know about servers. This may have changed. I'm not an accountant, but oftentimes warranties also end after 3 years. So it's sometimes better to just buy new hardware versus paying the support fees. Then the third component of total cost of ownership is these intangible or hidden costs. Like I said, that these are things that people forget. One area to consider if you do buy or outsource is that you have someone to help you bear the burden of dealing with outages, or if there are system crashes, and hopefully not a disaster, but disasters do happen. So also with the data security and privacy issues, you have some support in the sense that the software company that provided software, or is your software as a solution provider, they have done a lot to build in security provisions in the system. So you are not alone in that responsibility. There are always opportunity costs. Whatever you do, there's always opportunity costs. With this time, the money, the staff, there are other things you could be doing. So that's just always something to be aware of. That you have to understand what value this system is going to be bringing to you. I put management and public health risk here just because you are obviously using this system to help improve service delivery, or to improve the quality of service, to better manage health services. And this kind of comes back to the opportunity cost too sometimes, is that people think, well, this is a lot of money for an HIS project. I'm spending $1 million, $2 million, $3 million. This is a lot of money when we still have, we still can't meet our payroll for our health workers. We can't, don't have enough money to ensure running water in the remote facilities. And these are trade-offs, and I think that I think it's a balance. It's a balance because I think there's definitely risk in not providing all of that, including the health information systems. We are probably not aware of the missed opportunities because we haven't had the data to analyze and perhaps detect a disease outbreak much earlier than we are now. If we have the data, we might be able to detect the trends and detect that outbreak much sooner. And there's ongoing investment in change management, and there are costs there, right? There's resistance to change. You may have a champion who leaves, and a new person comes in and is not as supportive of the system. You have these management responsibilities and challenges. For the sake of time, let me just continue the next slide, and we can always come back if there are more questions on this. I used this slide last time, again, another factor in that build or buy or outsource decision is the kind of requirements you have for the system. It's really important to understand your requirements and to express them clearly, which is the point of the picture on the right. It's a humorous picture, but it's amazing how one statement can be misconstrued or just interpreted one way or another way based on one's perspective. So, defining requirements is you probably hear this all the time, and it's a very broad statement, and it's hard for people to understand what to do because it's so broad. So what I try to do is break this down into categories, and I think this does give you a better starting point to define your requirements. And it includes requirements that people might overlook or just sort of gloss over and not realize how important it is. For instance, operational requirements. You know, it may be important to say that you need to be able to access the system on a 24/7 basis. Or you need to be able to access technical support 24/7. But maybe it's not that important. Maybe it's just Monday through Friday, 8 to 5. It's important to include these kinds of requirements because they will ultimately be reflected in the cost of the system and the staffing that you'll need. The quote-unquote business requirements might be, let's say, there's a new health insurance policy, national health insurance that's now in place. That's been enacted in law, and it's set to go into law and be effective, January 1st, 2018. Well, now you have got a hard deadline. You need a new HIS system to enroll patients against this national health insurance system, and that has to be working by January 1st, 2018, when the law goes into effect. So that's an example of quote-unquote business requirements. Maybe you would, legal and regulatory, I think of more as privacy, and I think I'm also hearing more these days about countries saying that the data must be hosted in country. So that's that could be another that's another area of requirements. Fourth factor, you know your environment best. Is it an environment that's changing pretty frequently or growing really fast? Or is it, are your processes or your workflows fairly consistent and, fairly static? If you feel that there will be a frequent need to customize the software, then you may want to look at building the software from scratch. But knowing that there are that does incur additional time, additional resources, you can also still consider buying software or outsourcing. Just look for a solution that's highly configurable and customizable, and that perhaps you can use the services of that company to customize and the system, and maybe even do additional, provide additional software development services for you. There's often a consulting division of these organizations that can do custom development for you. And again, as I mentioned before, you will benefit from that these products are battle tested, as I would say, or field tested, right? They've been used by hundreds and thousands of customers. So a lot of issues have been worked out of the system already. Again, this will be a big factor, actually. Is there a viable company in your market, a good software company, a reputable software company, or an outsourced solution provider? If you don't feel that you have good options, then again, you can look at building with software. These bullets here help you or some different ways to evaluate these companies. Talking to multiple references. You may want to go to their office. If you've never heard of this company before, it's good to meet them at their location. Hopefully they are a viable company, and hopefully that's evident when you visit them. It's a busy office, and ask for a technical overview from their sales engineer, if they call it that, but someone who can talk at a technology level, not just at the quote-unquote sales level. I can tell you a story from someone who was ex-Microsoft and also worked at WHO, and they would ask tough questions. They would actually ask the software company, when will your system crash? Under what conditions will your system crash, and what do you do? What do you do to recover from that? And they would see the salespeople's expression on their face, because Microsoft being a software company, they know very well what the weaknesses are in their system. And so don't be afraid to ask tough questions. So I won't go into each one of these here, but these are just some of the ways to evaluate these companies. Oh, maybe I'll just mention the last point. This is an approach we took in a long time ago at a previous job. We hired a consultant to help us because we didn't know the landscape of the companies that provide the software we need. It was for a customer support, a tech support department. The call center that we had with 100 people. We needed a system to support this call center, tracking the calls and the customers and the products. And we just didn't know the full landscape. So instead of trying to do all the research ourselves, we hired a consultant who works specifically in that space. So that's one possibility for you. Oops, let's see. Oh, sorry. Where's my slides here? Okay. I've talked about the skill or the availability of software companies. There's also the availability of your IT staff and the skill sets. Are they available in your environment, in your region, locally or nationally? That will again impact, especially if you are seriously considering building the software from scratch. This list is on this slide is pretty exhaustive. You may not need all of these roles, and you will probably start small and build up to this. And if you don't have an IT team yet, my recommendation would be to hire a somewhat senior level person first, an architect level person that has some project management experience as well as that has a technical understanding to help guide you, and then they can build up the team from there. Actually, I think I might have skipped a slide. Let me just see if I go back up. Okay, yes, I'm sorry. I think I skipped this slide. So let's talk about this just a little bit. So again, what's available in your environment? The skill and capacity, it's quite variable. Quality of education is variable. What I found is that there are a lot of software developers out there now. What's harder to find is experienced project managers and architects. And it's just because it's just a maturing sector. It's usually that, like myself, software developers move into project management. So that could happen over 5 to 7 years. It depends on when they decide that they're tired of coding and worrying about where their semicolon is and want to have some responsibilities over the entire project. They get more interested in understanding business processes, perhaps. They get more interested in being involved in the working with the users directly and working on the design. So it's part of an evolution of the sector, and I think it's more and more every day where you're finding good people who can be project managers. Also, you're looking for people who really have an analytical and logical mindset. I've worked with people who don't have a software development background, and they're really sharp. They just have that analytical, logical mindset. So they learn how to be project managers pretty quickly. And the challenge we always face is that, working in the public sector, the salaries just, of course, just aren't as high as what the private sector offers. So this is always going to be a challenge. And obviously, we're not going to solve that on this webinar. But again, these are all aspects that influence what pool of tech resources you can access in your location. And this is the pool, as I mentioned. This is kind of the breadth of skills. I mean, the real main point of this slide is to show that it is actually made up of different specialties. I said earlier how people are very aware that they need to hire software developers, or they always think about adding software developers to a project. But they don't fully understand that there's quite a range of skill sets needed. And I actually use the analogy of the field of medicine, that there's so many different specialties in medicine. Your cardiothoracic surgeon is not the same as your, let's say, as your pediatrician. They have the same initial training, but then they go and specialize. Technology is very complex, and that does require specialization. For smaller projects, you may be able to combine some of these roles, which is actually, that's actually what I had done in my past, and others. I wore a lot of different hats. But the larger projects, you will need to hire full-time people, like a full-time data modeler. You can't. I've been project manager and data modeler, but when the project got large, I needed to break off. I needed to be just a project manager and hire a full-time data modeler. So again, depending on the size of your project, you may need some of these roles, and the larger the project, the more likely you will need all of these roles. Okay, I just talked about this slide. I think I got ahead of myself here. Yeah, so I've just covered all these points, and like I said, if you're at the very beginning of building your IT team, I recommend starting with a senior person, someone like an architect who understands the technology well, but also has the management experience, has the overall project experience. Let's see. Technology preferences can also obviously influence this. You may choose a technology because your IT team already has the skills to support it. If you're a Microsoft shop, you may want to go with a system from Microsoft. If you've been using Oracle, then you may want to go with a system from Oracle. If open source is a priority for you, then you will want to look at open source systems. That's definitely something to consider. Looking at sustainability, you want to see, well, what's in use locally, because that's who you can get for support. That's the likely consultants or contractors that you might be able to get locally. Those are, if they're specializing in certain skills, you want to potentially use those same technologies. Sorry, specializing in certain technologies. The obsolescence question is a bit hard to predict, of course, but I think that, again, if you have someone like an architect, they are very aware of the trends. So they all know where, where people are going in terms of the different database technologies, the programming languages, everything moving to the cloud, if you will. They will know about these trends and help guide you. Cost, of course, might influence which technology you go with, and of course interoperability. That's in our health context. There are certain data standards, coding standards those could be very important to you if you're, if we're specifically talking about something like an electronic medical record. And it's not, when you make these decisions, it's not necessarily a blanket decision. As I mentioned, if you choose to go with one particular solution or one approach like open source, that might not work for the entire system. So this was this company I spoke with. Actually, it was originally part of the World Bank. They developed an online procurement system and wanted to do it completely in open source, but they ended up using Oracle. And this was back, I think, in 2008 or 2009, because at that time, Oracle had the most comprehensive multi-language capabilities. So I guess at that time, I'm trying to think what they were looking at for open source databases, maybe MySQL or Postgres, but at that time, the language support just didn't meet their needs. So again, don't worry that one company has to provide the entire solution, and maybe that you're going to do a little bit of mixing and matching. Okay, I'm just looking at time. I want to make sure I'm okay. Yes, system availability, performance, and security. This is from an old study, old meaning back in 2008 and 2009 when I did this work for HMN and Rockefeller and Voxiva. There was a study that actually said that that it was actually the management and human factors that were the most or a significant reason for failures in the hosting environment. And this is something I used to see. I don't know how much is happening now. I think it still happens to some extent, that a lot of people still want to host everything on their own servers in their own building. But you are asking for a lot of responsibility for that if you do that. If the power goes out, you need redundant power sources. You need to deal with power surges, these kinds of things. You need to deal with the fact that systems will go down, and if this is a very critical system, let's say it's supporting an emergency hotline, that system really should not go down, and you have to try and get that system up as soon as possible. That means staff will have to come in at 3 a.m. if it has crashed at 3 a.m. So usually, I think though it's more and more understood that at least the hosting of the servers should be outsourced. That is a pretty, I think pretty easy business case to make. I think that the benefits there are pretty easily understood. So as I think with all technology, regulations and policy are behind. I cite here this report that came out in 2013 that I don't know if there has been any other report like this that actually looked beyond the US and Europe, but looked at several African and Asian countries at their privacy and security policies. And of course, as expected, it's very much in its infancy. So other than, as I mentioned, I know I've just from a couple of projects that we have at Japago that there are countries who now require data to be hosted locally, or they want you to go with a local company. So so this is something we just have to try and keep tabs on as the regulatory bodies play catch up. We have to be aware of their new laws and policies. There can be other priorities, the last factor here. And again, I'm not sure how much is happening now. I saw this back in 2008 and 2009, that there's a priority to support the local IT sector, to help that IT sector grow and contribute to the economic growth of the country. And they don't want to go with a company that's not based in country. They want to go, and they don't want to even go with a particular software company. They want to provide jobs for their graduates. So building from scratch, that could very well be a priority. Again, another previous project, there was a lot of turnover. There were something like 4 ministers of health in 3 years, something pretty aggressive like that. So, and in fact, that in that particular environment, one of the new ministers of health did not want to use the system that was in the process of implementation that had been approved by the previous minister of health, because they weren't going to get credit for it. This new minister had not made the decision for that new system, so they halted the implementation. So if your environment is very political like that, it's probably something to consider, to get that system implemented as fast as possible. That's again to the third point. So that's these political factors may come into play. So to close, and I know let's see if I can close this quickly. These next 3 slides try and compare the 3 choices. For building from scratch, what are the reasons to build? What are reasons not to build? And what are the main success criteria? So this hopefully summarizes what we've just been talking about. If you're going to buy a software package, here are the reasons to buy. The main, I guess I would say the main reasons to buy, the main reasons not to buy, and the success criteria. And it's not easy, right? It's not like a 1 and 0 on and off type of comparison. It's not always a clear cut. It's not always clear cut how to compare these factors. But hopefully this gives you a way to analyze it. And then the decision to outsource. Again, what are the most likely reasons to outsource, the likely reasons not to outsource, and the success criteria. So in conclusion, I think this presentation probably gave you a sense of the complexity of these, of implementing information systems, of managing them, of this decision itself. And I think that if you are in a position of making these decisions and don't feel you have all the background or experience to make that decision, then I would encourage you to bring in either a consultant or bring on to your staff, an experienced HIS manager or architect or implementer, someone who can guide you. There are quite a few resources available to help you. These webinars that we're doing, there are tools and frameworks like the ones that HMN originally worked on, WHO and ITU, and other NGOs, other organizations, other donors have supported these tools and frameworks. And then what's very helpful is joining a community like AHIN or other local groups in your area, because you can learn a lot from the members. If there's a monthly meeting or an annual meeting, you can share experiences. You can understand what challenges they face so that you can avoid going down the wrong path. So there's just a lot to learn from talking with your peers. So that's really valuable, to just get engaged in these kinds of communities. And with that, I will end with this picture where we are hopefully progressing from the mountains of paper that we're having to climb, and to more full automation to being able to produce analytics to better manage the health system in country. So let me stop there, and I guess I will exit this slide. And oh, this is a slide I didn't have time to go over, but I thought it was a bit too busy and detailed to go over. But this is another table to try and summarize and compare some of the different how the responsibilities are different between the build, buy, and outsource approaches. All right.
All right. Thank you for that lecture, Ms. Alice. For our attendees, if you have questions, please type them in the Q&A panel. If you cannot find the Q&A panel, please type them in the chat box. So for the first question, we have a question from Dr. Sambas from Cambodia. He's asking, what are the differences in importance between a cloud and a physical server?
I'm sorry, could you repeat that again? What was the difference between?
The importance of a cloud and a physical server.
Well, the difference is that when the system is hosted in the cloud, you are relieved of any responsibility for managing a server that you are physically hosting yourself. You have to maintain the network connection to access the cloud, but that is pretty much it. Now, like I said, I am generalizing here. I'm trying not to make it too complex, but I'm talking generally of the scenario where the entire system is hosted in the cloud. If you are physically hosting, you're responsible for everything on that server. And this gets into some details that probably most people aren't very interested in, from everything from the access, having reliable power for that server, having a backup for that server. You might have multiple servers so that if one crashes, it can fail over. That's the term, quote unquote, fail over to the other servers. The other servers will pick up the load if one server crashes. You might have multiple servers because you need to do load balancing. Again, there may be peaks and valleys in usage of the system. So you may need multiple servers so that you can handle those peak times, to handle the usage that is incurred during the peak times, and it'll balance the load across those servers. You have to worry about the actual disk space. I mean, most of us probably, we probably all have run into the problem with running out of disk space on our mobile phones if you're all smartphone users. Well, think about that on a server. You have to monitor that and be ready to, purchase more disk space, do some disk optimization to free up disk space. There's just a lot involved with the physical hosting of a server. I hope that helps.
All right, thank you, Ms. Alice. Here's the next question. This is from Dr. Alvin Marcelo from the Philippines. What is the minimum number of people in a team planning to do a procurement phase system? For example, a hospital information system for one hospital.
The minimum team, let's see. I would say, let me think out loud here a little bit. I would say someone who is, let's put the executive sponsor aside, for instance. Let's put that aside, just assuming that that's the person who is the ultimate decision maker who controls the budget. So let's put that aside and say it's just, if the question is about mainly in the selection process or evaluation process, then I would say someone who's very, very familiar with the workflows in the hospital and the rules and processes. And your technical architect or senior health information system project manager, that type of person. If you really want to get bare bones, I would say 2 people, but I would say probably more likely you're going to want to have some representative sample of the main users of the system. So let's say if the users of the system are all the medical staff, then it's probably going to mean there's a doctor and the nurse, and I'm not sure what other services in the hospital if this system would involve tracking the lab results. If there's a pharmacy, it may need a pharmacist. But you pretty much the approach I've taken, especially for larger projects, is that there's a core team, and then you might have an extended team of stakeholders that you would consult. So the core team you probably want to keep somewhat on the smaller side. I'd say 5 to 7 people. And maybe the hospital director, again, I'm not sure what the job titles are, if it's chief medical officer, chief of medicine, the head nurse, but whatever these key roles are might be part of the core team. And then you might have what I call the extended team of additional staff that will be consulted. So for instance, when it gets down to really understanding the details of the workflow, maybe you will go to the nurse supervisor. The nurse supervisor is probably much more closely involved on a day-to-day basis with the actual workflows versus the head of nursing, who may be more dealing with working on HR and working to improve working on the business processes at a higher level. So you probably need that sort of core, decision executive team, and then an extended team.
All right, thank you, Ms. Alice. Here is the following question from Dr. Alvin. Is it advisable to have one template procurement plan for a hospital information system and then reuse that for the procurement of other hospitals?
Oh, I would think so. I would definitely think so. That's what, I would think that it's not so different from hospital to hospital. I mean, of course, individual requirements will change, but major portions of the requirements will still apply. And I would think that's possible to do. And I know that's been done for other fields. I think PATH has worked on a logistics management information system template, requirements template, and of course, the world of financial and accounting systems has a pretty standard set of requirements. So I would think that, and there may be something out there that I'm sure there's something out there, and maybe it's just not shared publicly, but I'm sure that there are hospital information system requirements templates out there already.
Yes, following question from Dr. Alvin. The roles you listed do not exist in most ministries of health. Usually, these ministries are undermanned. Is this a sign to hire more people or to outsource?
What I would say is they need to have somebody. They need to have that HIS, whatever they want to call them, whether they call them HIS advisor, HIS specialist, there needs to be somebody, because ultimately it is still that government health institution's responsibility. It's ultimately still their system. It's their requirements, their facilities, their staff who are using it, and you need someone to liaise with a provider. And I would recommend, you may have somebody already, like there are some pretty savvy people within a government health institution, probably in the disease surveillance department or the statistical, the Department of Statistics, or, kind of the, there's going to be different names for these departments, but there's usually some pretty database savvy or data savvy people already. And so you could start with somebody like that, but given their responsibilities, they may not have time to really completely take on overall management of an HIS system and the rollout. So you could definitely outsource, the implementation, but there should be someone owning it, owning that responsibility from the ministry or government side. That's my personal opinion anyway.
All right, thank you, Ms. Alice. We're now down to our last 3 questions. For the remaining questions that we won't be able to answer for tonight, we will be sending them to our speakers so we can post the answers on ahin.org. All right, so another question here is on number 7, technology preferences. If the HIS is outsourced, would an MOH then be dependent on the supplier's technology preference?
Yes, I mean you would. I mean you may have some influence if there is something that you feel is important that they be using, yeah, ultimately you are going with whatever they choose to use. So I'm not sure. I'm not sure if there's more to that question that might that might help me provide a little bit better answer. But yes, you're ultimately you're kind of divorcing yourself from those concerns even, because when you're outsourcing, you just want it to work, right? You want that system to be up and running. You want to be able to access it. You want to be able to enter your data. Generate the reports, do referrals, whatever functionality that the system is doing. You often that's the end goal, right? That's the bottom of the line. The system needs to work, and you're less involved in those technology details. So again, I'm not sure what situation would prompt you to need to tell the outsource provider that there is a specific technology they need to use. Like if there's one that you think they need to interface with, that they need to interoperate with, that's a perfectly reasonable request. And I think that they ought to consider that. They'll obviously want to look at, well, if we develop the interface to this system, is this something that our other customers want? Because if it is something other customers will want, they will be willing to do it. But if it's a very unique request, a very unique system, they will be less inclined to do it, or they'll be willing to do it, but will ask a lot of money for you to for that work. So I hope that addresses that question a little bit.
All right, thank you, Ms. Alice. This question is from AHIN's chair, Dr. Bunchai from Thailand. It reads, among the 10 factors to decide build or buy, which are the 2 or 3 factors that are most important? And is there a study which weighs the importance of the 10 factors?
I don't think there's studies. I mean, these are, like I said, these are kind of these 10 factors are sort of what I've come to learn over the years. So I think there are probably some studies that have looked at some aspects of this, but I can't cite any off the top of my head. I think it's very variable. I would say that the build or buy, it's variable, meaning your particular environment and what your priorities are. I would just say that I guess the biggest difference is one big difference is time to implement. Building is usually going to take more time, and it has more risk. So because you're starting from nothing, whereas buying software, you're going with a known quantity, right? You're going with a known product. You can see it in operation. If you talk to 3 or 4 customers, you can ask to go visit those customers and see it in operation. So building really is going to be, I think, the exception, very much the exception. I think it's going to be if you really have some unique needs that nothing on the market can satisfy. It may also be, that, you just feel you don't have any good options locally. There are no good software companies, or maybe there are good software companies internationally, but they don't provide local support, and you really want local support. Someone who can speak in your language, or someone who can come visit you or go to your facilities and help you with the implementation there. So that if that's really important, then you may want to invest in building up your own HIS team. And that's going to be a big decision factor for the build option, obviously, is that you need to build up that HIS team. As Dr. Alvin just said, that usually they're very undermanned. So that's going to be a big issue if you will be able to build up that HIS team. I would say, assuming it's an undermanned environment, I would buy or outsource, and you can always build later. You can buy or outsource now, build up your experience, build up your understanding, and then if you are happy with what you've got, you stick with it. If you are not, now you have all this experience under your belt, so that if you are now just realizing that this just isn't working for you, and you need to build it, you've gained a lot of experience from working with this system provided by by a software company. I mean, buying still involves building up your HIS team because you're still taking over responsibility for managing the system. But at least the software development was done by somebody else, and all the software bug fixes and things are being done by somebody else. So I hopefully that helps. I'm always a little bit hesitant because I think everybody's situation is so different. So it's hard to kind of give you that one rule of thumb that you can apply everywhere. It's hard to come up with something like that.
Yes, now we're down to our last question. This is also from Dr. Bunchai. He says, people say that the most important thing in the project is getting the full support from the leaders of the organization. He's asking, what are your thoughts about this statement?
I totally agree with that. And, some of you who have been involved, you'll hear things about you need a champion. You need that executive sponsor. And I think a lot of organizations, that is how it works. I think it's often, it's not going to be a priority until the top level of the organization says it's a priority. People are not going to fall in line until that top level person says it's important. And when you have that top level leadership support, then you get the funding, then you get the resources. It's important when they give you budget, right? That to me is always, that is like the one indicator of what's important and what's a priority and what is not, is when the money is made available. Bottom line, that's what it comes down to in our world, right? Often it all comes down to money. Well, I should back it up. Let me back up. It's the political will, right? Once that leadership support, that political will is there, all the other things will come forward. The money will be made available. The people will be made available. Other resources, those will be tied to the money, of course.
Hello, can you hear me?
Yes.
Yeah. Thank you, Alice. It's very helpful, and I think we learn a lot of many things. And thank you for the structure or the framework that you give us. I know that it's very difficult to build or buy. We are experienced on that, but at least we have framework that you give, at least the last three questions that you summarized it. Thank you very much, and we hope that we can have you in our webinars many times. Thank you, Alice.
Oh, I'm glad it's helpful. Please send any feedback on improving the content. I know that this can be kind of very technical terminology, so we're happy to refine this, and I'm so happy that AHAN exists, and definitely look forward to being on more of these webinars.
Thank you so much, Ms. Alice. Thank you also for our participants for this webinar. And as you know, this is the second webinar of our HIS procurement series. We will also invite you to attend the following webinar on October 12th, also with Miss Alice. Thank you so much, everyone. Thank you, Miss Alice.
Thank you. Thank you. Good night.
Have a great day.
Thank you.